This animation is a guide to help you use the ASEPT drainage bag kit. Please read the instructions for use included with every case of ASEPT drainage bag kits. Important product information. The PFM Medical ASEPT drainage bag kit is an accessory to the ASEPT peritoneal drainage system and is to be used only for peritoneal drainage with the ASEPT peritoneal drainage catheter. The ASEPT peritoneal drainage system is indicated for periodic drainage of recurrent and symptomatic malignant ascites. The catheter is intended for long-term access of the peritoneal cavity in order to relieve symptoms such as dyspnea. The ASEPT drainage bag kit is a complete kit with all the items generally required for peritoneal drainage. Before using this product, make sure that you have been fully trained on the correct use of the items in this kit. If you have any questions or problems in regard to draining fluid, please contact your doctor or nurse. The drainage bag kit with drain line and procedure pack have been sterilized. This product is for single use only and is not to be reused. Do not use if the packaging appears to be opened or compromised. Use a new kit instead. The ASEPT drainage bag kit comes with all the items you need to drain fluid through your ASEPT catheter. The ASEPT drainage bag kit contains one drainage bag and one procedure bag with all the dressing change items. The ASEPT drainage bag includes the 2,000 milliliter drainage bag itself, scaled in 100 milliliter increments. The drain line, a clear plastic tube with a white pinch clamp. The ASEPT connector on the end of the drain line with a protective cap. A fluid release valve on the bottom of the bag. The procedure pack includes 2 pairs of gloves, 3 alcohol pads, 1 foam catheter pad, 6 gauze pads, the self-adhesive dressing, a blue emergency slide clamp. Note, if for any reason the catheter gets punctured or cut, follow these instructions. 1. Pinch the catheter closed between your fingers. 2. Push the blue emergency slide clamp included in the procedure pack over the catheter between the patient's body and the cut or leak, and push the catheter completely into the small end of the clamp. The clamp will close the catheter. 3. Contact your doctor or nurse immediately. Using the ASEPT drainage bag kit. Use of the ASEPT drainage bag kit should be easy since you have been fully trained. Follow these step-by-step instructions. You should drain fluid every 1 or 2 days, or as directed by your doctor. Before beginning the drainage procedure. 1. Locate a clean and uncluttered workspace. 2. Wash your hands with soap and water for at least 1 minute. 3. Remove the adhesive dressing, gauze pads, and foam catheter pad from over your catheter. Check for any redness, tenderness, swelling, or fluid around the catheter. If you see any signs of infection, do not continue with the drainage procedure and contact your doctor or nurse. Signs of infection include but are not limited to fever, increased sensitivity, pain, redness and/or swelling around the catheter exit site. Ready to begin. Peel open the drainage bag pouch all the way and leave the drainage bag on top of the pouch. Open the procedure pack by peeling the front and back of the pouch apart, starting at the top. Place the procedure pack on your workspace. Remove the tape and unfold the blue wrapping. Leave the enclosed items on the wrapping. The items and the inside of the wrapping are sterile. Don't touch them with your ungloved hands or other non-sterile items. Pick up one glove by the wrist and put it on. Pick up the other glove by the wrist and put it on the other hand. Both gloves fit either hand. Be careful not to let the outside of the gloves come in contact with anything non-sterile, for example, clothing or skin. The outside of the gloves need to remain sterile. Tear open the 3 alcohol pads, but do not remove the pads from the pouches. Place the pads on the blue wrapping. Connecting the drainage bag to the catheter. Squeeze the pinch clamp on the drainage line completely closed. Hold the catheter valve end in one hand and vigorously clean the valve surface and around the valve with one of the alcohol pads. Remove the protective cap from the ASEPT connector on the drain line and align it in the center of the silicone valve surface. Push the ASEPT connector into the silicone valve and twist to close. The connection must be tight to open the valve and allow the flow of fluid. Warning: make sure the connection is tight. Draining fluid into the bag. Place the drainage bag below your catheter. The drainage bag requires gravity to collect fluid. Release the pinch clamp on the drainage line slowly to begin draining fluid. The fluid will flow into the bag. Note: should there be leakage in the bottom of the bag, check the blue release valve and make sure that it is all the way pushed up towards the bag. If there is little or no fluid flow, check and ensure that the connection between the ASEPT connector and the valve is tight. Remove your gloves and discard. You adjust the flow by squeezing the clamp partially closed. The fluid may slow down when the fluid is almost completely drained. When the flow stops or the bag appears to be full, close the drain line by squeezing the pinch clamp completely closed. Warning: do not drain more than 2,000 milliliters from your abdomen during any 24-hour period. Follow your physician's direction in regards to frequency and amount of fluid drainage. Do not use scissors or other sharp objects near the ASEPT drainage catheter. The blue slide clamp should be used to clamp off the catheter if you accidentally cut the catheter. After draining the fluid, placing a new dressing. Make sure the pinch clamp on the drain line is fully closed. Then disconnect the drain line from the valve. Put on the second pair of gloves included with the procedure pack. Pick up one glove by the wrist and put it on. Pick up the other glove by the wrist and put it on the other hand. Both gloves fit either hand. Be careful not to let the outside of the gloves come in contact with anything non-sterile, for example, clothing or skin. Disinfect the area around the catheter exit site with the remaining 2 alcohol pads. Remove and discard the framed center panel of the self-adhesive dressing. Note: the framed center panel is on the opposite of the printed side. Put the dressing back on the blue wrapping. Place the foam catheter pad around the catheter. Curl the catheter around in a circle and place it on top of the foam pad. Be very careful not to kink the catheter. Place the gauze pads over the top of the catheter and hold them down. Applying the dressing. Peel the dressing from the printed paper backing, exposing the adhesive surface. View the area where the dressing is to be applied through the film and center the dressing over the wound. Press it down. Do not stretch the dressing during the application. Slowly remove the remaining paper frame by peeling it off the split section while smoothing down the dressing edges. Once removed, smooth the entire dressing from the center toward the edges and firmly push down the dressing. Remove your gloves and discard. Disposal after use. Empty the bag in the toilet or sink by pulling down the release valve on the bottom of the bag. Discard the empty bag. For additional information on the use of this product, read the instructions for use included with every case of ASEPT drainage kits.